Yes, I think I would like first to thank the organizer for the invitation, for giving WHO the opportunity also to contribute to this important conference. I mean, as part of our work, we try to support member states and Ministry of Health around the globe on trying to carve effective national responses for the prevention of those conditions. And cancer is really an important condition that takes a lot of life and suffering, and we know that about 8.8 million people worldwide are dying for cancer. So it's the second cause of death for non-communicable disease after cardiovascular disease. So it's really an important public health concern that we are tackling here. So it's important that WHO take part of those activities and conferences meeting to raise awareness and also to discuss, the better strategy and the last scientific development in the management and prevention of those conditions. Well, there is the dimension of clinical management, which is called about the guidelines. But beyond that, there is also the public health approach on how cancer can be prevented at the first place. Looking at the population level intervention like tobacco prevention is an important element of any cancer prevention program worldwide. So it's not just about talking about guidelines for clinical management, for the early detection, for the surgical aspect, for the medical therapies, but beyond that also trying to look at what are the strategies for prevention, early detection, management, even palliative care, which is one of the stream of this conference also need to be included in our discussion. So clearly, guidelines are part of this, and knowledge is moving. But what is important, perhaps, for a conference that is held here in Egypt and for the region, is that whatever happened in Canada or in Switzerland or the United States need to be tailored to the context of our countries. So the epidemiology might be slightly different, but most importantly, the systems. The health service provision is different from a country to country, so we need to take into account those aspects of the system disparities so that we carve responses that are really contextualized. Cancer, like all the non-communicable disease, by definition require multi-stakeholder involvement, multidisciplinary teams, and starting from the patient themselves, so coalition not only of health professionals or public health officials, but also having communities, patients being involved in understanding how we can raise our awareness, advocate for the provision of effective services that are reaching all. I think we have been working with the group of panelists, and tomorrow morning we will meet also to try to carve a kind of consensus on a resolution or what could be, some of the main recommendations that this conference come from. And as I mentioned, it spans from prevention, early detection, management, and some aspect of palliative care. So we try to also align those recommendations with what WHO is recommending in terms of normative work in this field of cancer prevention and control. And in the region, the countries have recently adopted during a regional committee a regional resolution on the prevention and cancer with a framework that guide a bit the countries, kind of roadmap for countries to follow if you want to better address cancer prevention and control. So we'll try to have this dialogue with the conference organizers of how we can match the conference-specific recommendation with more broader initiatives taking place at the moment to support our member state in the region. I'm a clinician by training, and sometimes, we used to be so much involved in individual care that we tend to lose a bit the public health perspective on how actually clinicians can contribute to that. So I would invite them also to take into consideration what is happening at the level of their ministries, at the national level, and be informed about the national strategies and see how they can contribute to that, so that progressively all those converging efforts will try to reduce the impact and the burden of cancer.